How does gastrin affect type 2 gastric carcinoid tumors? Imagine a hormone that acts like a growth signal in your stomach. That hormone is gastrin, and it plays a key role in certain stomach tumors called type 2 gastric carcinoids. These tumors develop when gastrin levels in the blood become abnormally high, a condition known as hypergastrinemia. This usually happens because of tumors called gastrinomas, which produce excess gastrin. These gastrinomas are often linked to a condition called Zollinger-Ellison syndrome and a genetic disorder called multiple endocrine neoplasia type 1. When gastrin levels are high, they stimulate special cells in the stomach lining called enterochromafin-like cells. These cells normally help regulate stomach acid, but when stimulated excessively, they start to grow more rapidly and can transform into tumors. This process is called hyperplasia, which means increased cell growth. And over time, some of these cells can become cancerous, forming carcinoid tumors. Gastrin acts as a growth factor specifically for these enterochromafin-like cells. It encourages their proliferation and can lead to their transformation into tumors, especially in the setting of high gastrin levels caused by gastrinomas. Interestingly, unlike other types of gastric carcinoids that develop because of chronic stomach inflammation and low acid levels, type 2 tumors happen despite the stomach producing a lot of acid. This is because the gastrinomas cause the stomach to secrete too much acid, yet the high gastrin still drives tumor growth. The genetic aspect also plays a role. Mutations or inactivation of the MEN1 gene can remove the brakes on cell growth, further promoting tumor development. Type 2 gastric carcinoids tend to be multiple and small, but they have a higher chance of spreading to nearby lymph nodes compared to type 1 tumors. They usually grow slowly, and most patients do not face immediate danger from the tumors themselves. However, the outlook can depend on how advanced the tumor is and whether it has spread. Treatment options include surgically removing the tumors, sometimes removing the entire stomach, or using medications called somatostatin analogs to reduce gastrin levels and slow tumor growth. Managing the excess acid production with proton pump inhibitors is common, but these drugs can actually increase gastrin levels further, so they are used carefully. It's important to remember that controlling gastrin levels is a key part of managing these tumors, and ongoing medical supervision is essential. In summary, gastrin is a central player in the development of type 2 gastric carcinoid tumors. When gastrin levels are abnormally high due to gastrinomas, they stimulate the growth of enterochromafin-like cells in the stomach lining. This hormonal stimulation leads to hyperplasia and can eventually cause these cells to turn into tumors. Understanding this process helps doctors develop targeted treatments and monitor patients effectively. If you or someone you know has concerns about stomach tumors or hormonal imbalances, always consult a healthcare professional for personalized advice and appropriate testing.